Welcome back to Audible Pathology. This is Dr. Swati Sharma, pathologist, who is going to help you just recapitulate and learn pathology while you are relaxing. So here comes the next thing of liver audible pathology, hepatic infarcts. First of all, hepatic infarcts are very rare. Now, why they are rare? The simple reason is because there is dual blood supply. Dual blood supply, one is portal vein, another is hepatic artery. So liver having less amount of blood, it's something which is very rare. So if at all it happens, so it can be because of embolism, maybe sepsis, eclampsia, DIC, and very one of the most important cause which is being asked repeatedly, the question number 4. The chronic passive venous congestion, the CVC liver, that gives the gross appearance of nutmeg liver. Question repeatedly asked in your practicals, because you will be having these specimens. You will be asked this thing in NEET PG and also sometimes in your super specialization exams. So nutmeg appearance, so you will have congested red-brown pericentral zones, that is the combination of hyperperfusion and retrograde congestion which acts synergistically to cause centrilobular hemorrhagic necrosis. Okay, so that is the nutmeg liver. Okay, so red and white infarcts, overall both can be there, but red infarct is definitely more common in those areas or organs where dual blood supply is there. Okay, so now coming to a very beautiful topic, hepatitis. Okay, so earlier what was done was that there was a classification for hepatitis. It was 2 types. One is chronic persistent hepatitis and one was active hepatitis. So persistent means it is there, so that is limiting plate is not damaged here. It is just because it is just restricted to the portal tract, so you have inflammation around the portal tract, but the limiting plate which it is not damaged. And the chronic active hepatitis is the one damaging the limiting plate. Okay, and then further extending, but then it has been replaced by the new classification of hepatitis. So just before going to the new classification, I'll give a 1 second brief about a liver failure. That liver failure can be acute, it can be subfulminant, it can be fulminant. Okay, acute is which develops within 6 months of jaundice onset. In subfulminant, the same thing will happen rapidly, that is 3 months. And if it is fulminant, the same thing, that is encephalopathy after 2 weeks of the jaundice onset. So that is just acute, 6 months, subfulminant 3 months, fulminant 2 weeks. Okay, coming back to the latest classification of hepatitis. Okay, so hepatitis, it is based on what is the cause, what is the histology that you are saying, and how it is progressing. So you can have by the cause, like you say, it is viral hepatitis, you can say it is autoimmune hepatitis, or it is drug-induced hepatitis. So whatever the cause is, the hepatitis is according to that etiology. Then you have classification by grade, that is a histologic activity. The histologic activity or grade is being measured by 2 things. You have to see the necrosis, how much it is the necrosis, and then inflammation. Okay, so on biopsy you are going to see. So how you are going to see whether portal inflammation, it is portal inflammation, it is periportal necrosis, it is piecemeal necrosis, or it is bridging necrosis. Okay, so that means which part of it is involved and how much it is involved, necrosis and inflammation. Okay, so then you come to the stage, classification by stage, that is the degree of fibrosis. So it reflects a progression, because any inflammation is, most of the inflammation they conclude with inflammation, with the fibrosis. So fibrosis, more the fibrosis, more is the chronicity of the disease. Okay, so you have 4 grades, that is in 0 there is no fibrosis, and in 4th you have the 0 to 4. In the 4th one you have cirrhosis. Cirrhosis is the last stage where the fibrosis will be there. So in between you have to go for mild, moderate and severe fibrosis. So how do you know this is mild fibrosis? How do you not going to count the lymphocytes actually, but you are going to see the mild, moderate, severe fibrosis according to the region which is involved with the inflammation. How? Mild fibrosis, that means we are starting from the zone 3. Okay, coming back, let's go back to the liver hexagon structure. Okay, so if it is there within the portal tract, it is mild. It is going beyond that, but still periportal only. Okay, that is very now it is not central vein, is still far away. It is moderate. You need to worry. But severe, that means bridging fibrosis has taken place. Okay, so the central vein to portal vein, so that has taken place. Something to worry a lot. And lastly, the cirrhosis will take place. Okay, so you can see the images, and you can have the different this inflammation images, and you can just make them in your mind. Okay, so this audible pathology is basically it's like a novel. You are hearing it and you are just imagining it, and that is, you're putting this thing into your subconscious mind. So whenever you're going to give the exam, this will come out automatically, right? Okay, so now the next thing, what is acute hepatitis and what is chronic hepatitis? Okay, so acute hepatitis, some of the features. So when you are going to see these features, the mind should click that this is acute hepatitis. So it is ballooning degeneration. As the name suggests, ballooner, that means swell up. So swelling of hepatocytes. Okay, the polygonal shape of a single hepatocyte is being lost to the round and swollen hepatocyte. Okay, so this round shape of rather than polygonal is ballooning. Okay, then we read out councilman body in necrosis. So councilman body are the apoptotic bodies. Okay, that is also a sign of acute hepatitis. Then you have lobular hepatitis. Lobular hepatitis means where the lobular architecture is being disrupted. Okay, then you have bridging necrosis, but not that common. Bridging necrosis only seen if it is in acute and severe. Okay, so central portal bridging necrosis only in severe acute hepatitis, not that. And spotty necrosis, okay, just in a focal area. Okay, so let's imagine ballooning degeneration. Let's imagine the councilman bodies, then lobular hepatitis, bridging necrosis, spotty necrosis, acute hepatitis. Okay, commonly question asked, acute hepatitis, you have to remember two things, ballooning degeneration, and you have to remember councilman bodies. Then you have chronic hepatitis. The chronicity is there. What? Ground glass appearance. Ground glass appearance, a very common term used anywhere in pathology. But in liver, if it is coming ground glass appearance, you need to think of nothing but hepatitis B surface antigen. A very pathognomic and a beautiful image that you can just see and remember. Okay, so there it will be like pale and pale eosinophilic color and very homogeneously pink. Okay, so you can you can remember that. They are also known as the Hadziani cells or Shikata cells. Okay, so this is the first feature of the chronic hepatitis. Then the second feature is piecemeal necrosis or interface hepatitis. Piecemeal necrosis means, again going back, that means interface hepatitis, around that is limiting plate. And where did you see it? Let's recapitulate. Hepatitis, that is viral hepatitis, autoimmune hepatitis, tier 2 hepatitis. Good. Then you have bridging necrosis and fibrosis. So bridging necrosis and fibrosis, if you have to see, they are going to be there in this. Then you have cirrhosis, definitely, since it is going to be a chronic thing, and ductal reaction, fatty chain. So these are all the things, ductal reaction, fatty chain, they are also seen in the chronic hepatitis. Okay, so let's recapitulate once again. When you say ballooning degeneration, so you have to remember that the size of the cell of the hepatocyte having ballooning degeneration 2 to 3 times the size of the adjacent hepatocyte, and it's a wispy cleared cytoplasm. They are seen in acute hepatitis. Okay, so councilman bodies, dead red apoptosis. Okay, then chronic one, just an important point here, chronic viral hepatitis, when it is due to HCV, then it will show portal tract expansion by lymphoid follicles. So much of inflammation leading to formation of lymphoid follicle. Think of hepatitis C. Okay. So here we complete with a brief about the hepatitis and its introduction. So stopping here, recapitulating for 5 minutes. Okay. So you are going to remember just small, this was your 5 minutes break. You listen to it, you have remembered it. Now go back to your studies, whatever you were reading, just revise it, put it in your subconscious mind. It will come back automatically. Just keep listening. Thank you.